and I'll be your nurse practitioner today that will be doing your head-to-toe assessment. So I'm just going to wash my hands really quick. And before coming in, I did close the door and ensure adequate lighting for this assessment. Since I'll be doing the assessment, please let me know at any time if you feel any pain or discomfort. I will also be observing for that as well. So I'm just going to go ahead and take a look at your general appearance and your color. It looks like you are very well nourished and there's no odor or anything like that. And your skin is inconsistent with your ethnicity. So everything looks good there. So I'm just going to start with your head. I'm just going to go ahead and take a look and palpate your head here. Any pain or anything like that? No lesions or abrasions or anything abnormal here. I'm just going to take a look at your face. Go ahead and raise your eyebrows, puff your cheeks, and smile. Perfect. And that is cranial nerve number 7. Also, before coming in here, we did already check your vital signs, which are all normal. And we did a visual acuity test, which is 20/20. So that is cranial nerve number 2, which is your optic nerve. And that is intact as well. Okay, so now I'm going to go ahead and take a look at your eyes here. So I'm just going to use a pen light here to shine light into your eyes. I'm just going to check for your pupil reaction. So just go ahead and stare at my nose. I'm just going to shine light, and your pupils are reactive to light bilaterally. And you're just going to go ahead and keep your head still and follow the pen light with just your eyes, okay? So here I'm checking for your ocular, motor, trochlear, and abducens nerves, which is all your eye movement, and those are all intact. Now I'm just going to check for accommodation, just so go ahead and stare at my nose, and then go ahead and look straight ahead. Perfect. So that is accommodation, which is also intact. Your sclera, your conjunctiva, I'm going to pull down here. Everything looks intact. No abrasions or lesions noted. Any pain with eyes or anything like that? Okay. Now I'm going to just check your ears. Your canal, everything looks good. No abrasions or anything. I'm going to palpate your mastoid. Any pain here? Perfect. Now I'm just going to go ahead and take a look at both of your ears on each side. I'm going to pull up and back, and your cone of light is visible at 5 o'clock. And then I'm going to do the same thing on the other side, but for the purpose of this video, to save time, I will just do this one side. That was your ears. Before I move down, I'm just going to check your sinuses. So you're going to have your frontal sinuses, any pain here? Your ethmoid sinuses, any pain here? And your maxillary sinuses, any pain here? Perfect. Now I'm just going to check your nose and your septum. Everything appears midline, and the patency is there. Go ahead and blow out for me. Perfect. Any pain there with your nose? Perfect. Now I'm just going to palpate your temporal maxillary joint, which is back here. Can you open and close your jaw for me? Perfect. And that is trigeminal nerve number 5, so that is intact. Now I'm going to go and take a look at your mouth here. So go ahead and open your mouth. Your mucosal, everything looks normal, no abrasions, no mucus or drainage there. Go ahead and move your tongue side to side. Perfect, and that is your tongue movement, which is cranial nerve number 12. We also did check the gag reflex, which is also cranial nerve numbers 9 and 10. Okay, so now I'm just going to go ahead and also have you move against my hand, which is just going to check your facial movement. And then same thing on the other side. Perfect. That's also your spinal, so that's also cranial nerve 11. Okay, so everything there looks good. Now I'm just going to move to your neck. I'm just going to palpate here for your lymph nodes. Any pain there? Perfect. I'm going to move down towards your neck. I'm just going to palpate the carotid artery on both sides. Your neck and your throat are midline. No lumps or lesions. Any pain there? Perfect. Now I'm just going to go ahead and have you turn your neck and this way and to the back. Perfect. Any pain there? No. Perfect. Now I'm just going to have you shrug your shoulders, and this is also spinal nerve here. Go ahead and push up against my hand. Perfect. Now since we're here, I'm just going to go ahead and check your range of motion. So just go ahead and move your arms like this for me, and same on the other side. And do the same thing while I palpate your joint here. Just move it up and down. Perfect. And then I'm going to do the same thing on this side. Go ahead. Perfect. And you're going to push up against my hand and push down. Perfect. And push out against my hand. Good. Now you're going to go ahead and squeeze my fingers. Perfect. I'm going to check your radial pulses here, which are intact. I'm just going to go ahead and check your skin here. Skin turgor is present with elasticity. It's very warm. Capillary refill is less than 3 seconds. Can you go ahead and wiggle your fingers for me? Any pain or anything like that? Perfect. Everything looks good. I'm also just going to check skin turgor here, which is also present. All right. Doing okay so far? Good. So now I'm just going to take a listen to your lungs and your heart sounds in the front, and then we'll move to the back, okay? So first I'm just going to do the lung sounds in the front, and then we'll go to the back. So your lung sounds, take a deep breath. Perfect. Now I'm going to go to the back and listen to your lung sounds, so if you can turn over for me. Perfect. Go ahead and take a deep breath. Perfect. And before you turn around, I'm going to do a test called tactile thermitis, where you're going to say 99 every time I place my hand, and I should feel the vibrations equally on both sides.
99, 99, 99.
Perfect. Now I'm going to check for respiratory excursion, which is where I'm going to place my hands on the back here, and you can go ahead and inhale, and I should see my hands move equally bilaterally on both sides, which is present. Now I'm going to look for diaphragmatic excursion. So the first thing I'm going to have you do is go ahead and inhale, exhale, and hold. And I'm just going to percuss to see where it stops. Okay, and now you can go ahead and exhale and hold. Perfect. So that is between it's 4 centimeters, which is between the normal, which is 3 and 5 centimeters, and I would do that bilaterally on the other side as well. Okay, perfect. So you can go ahead and turn back for me. Now I'm going to take a listen to your heart sounds, okay? First I'm going to take a listen to your carotid over here. On the other side. Perfect. Now I'm going to listen to your heart sounds aortic, pulmonic, herbs, tricuspid, and mitral valve, which is the point of maximal impulse. So I'm going to do the same with the bell. Aortic, pulmonic, herbs, tricuspid, mitral, which is the point of maximal impulse. Okay? Before I do anything else, I'm going to go ahead and have you lay down. Perfect. Any pain or discomfort at this time? Okay. So I'm going to go ahead and take a look at your abdomen. Everything looks great. No hernias, lesions, abrasions, or rashes noted anywhere. Before I move down, I'm just going to go ahead and take a listen to any bruits. So I'm going to listen to your aortic, renal, iliac, and then femoral. Now I'm going to take a listen to all 4 quadrants of your stomach. 2, 3, 4. And now I'm just going to gently take a feel and let me know at any time if you have any pain. Just a light palpation here. Any pain or discomfort?
No.
Perfect. Everything looks good there. So now we're going to move down towards your hips. So I'm pretty much going to hold your hip, but I'm also going to check for your joints, and then you're going to check your range of motion.
Okay.
So go ahead and lift up your knees here. Any pain?
No.
All right, now move your hip out and back in. Perfect. And now I'm going to move down to your knee. Go ahead and put your knee down. Perfect. Any pain here at your knee joints? Perfect. Go ahead and move your ankles side to side. Perfect. So range of motion isn't good. No pain, no edema, or anything noted. I'm going to check your peripheral pedal pulses here, which are intact. Go ahead and wiggle your toes. Perfect. Push up against my hand and push down against my hand. Then go ahead and push up against my hand. Perfect. Very good. Everything looks good here. Perfect. Now I'm going to have you sit up for me. And before we do anything, I'm just going to do 2 more hearing tests here, since I have this in my hand. This is called the Weber test. So basically, you're going to hear the conduction on both sides. You should hear them both bilaterally equally. So let me know if you do. Perfect. So now we're going to do bone to air conduction. So what I'm going to do first is hit this. You're going to listen, tell me when it stops. I'm going to move it to here, and you tell me when it stops, okay? supposed to do it the other way. Okay, so that's good. Now I'm just going to check for your bone conduction on your wrist and then also on your feet. So tell me if you feel this. Here, yeah. Perfect. Here, yeah. And here. Perfect, very good. So now I'm going to go ahead and check your, this is going to be checking your sensations for pain and touch. So I'm going to use a soft side and a pointy side. So this is what soft feels like, and this is what pointy feels like. Okay, so go ahead and close your eyes, and then I'm going to touch you here. Perfect, thank you. Everything looks good there. Any pain or discomfort right now? Perfect. Just going to put this back. Okay, so now before we begin, I'm just going to have you do a finger to nose thing. So basically you're just going to touch your nose and then touch my finger, okay? Perfect. Perfect. Now you're going to do a rapid alternating movement, so I'm going to have you go ahead and go like this. Perfect, very good. And now we're going to do heel to shin, so I'm going to have you put your heel all the way down to your shin. Again on the both sides. Perfect. Now I'm going to have you stand up nice and tall, feet together. And you're just going to close your eyes. This is a Romberg test, a test for your balance, which is also cranial nerve number 8. So we're noticing for any swaying here, which is not present, so that is great. Before you take a seat, I'm going to have you do a shallow knee bend, so go ahead and just bend your knees all the way to the floor. Perfect, and you're going to walk towards that chair, just nice and straight. And then now you're going to walk back heel to toe. Perfect, and now on your heels, you're going to walk on your heels, and walk on your tippy toes. Perfect, very good. And you can go ahead and take a seat. Now we're just going to check for your reflexes, okay? So we're going to check your brachioradialis first. So just go ahead and relax your arm. Okay. Now you're going to check your biceps. And then now your triceps. So just go ahead and relax your arms, okay? Perfect. Now we're going to check your patellar. So go ahead and sit all the way back and let your feet relax. Perfect. Now you're going to check your Achilles reflex. Perfect. And then now we're going to just go ahead and check Babinski. Just go ahead and relax. And then I would do this equally bilaterally on both sides, so that is all intact. Okay? Do you have any questions for me? Nope. Perfect. Your exam looks great. All of your neuro checks are intact, and otherwise, that is the last of our assessment. Thank you.